Doctors have read it. What is something that you wish everyone knew about their body? 2 things. Can I do 2 things? Are you gonna allow me to do 2 things? I'll do 2 things. Thing number 1, fevers are a protective mechanism that your body uses to improve its protection from the outside world. So when your body is experiencing invasion from bacteria or viruses, it actually increases its core temperature. And as a result, your body gets warmer, so your immune system functions more efficiently, and viruses cannot replicate as well at higher temperatures. Don't get me wrong, there are times where we need to lower someone's fever. So there is no one-size-fits-all rule for this, but for me, and again, I'm gonna say for me because you should always consult your own doctor. If I have a mild fever, I clap for my body that it's helping me beat the infection. Number 2, pain is a signal from the body to warn you that something is going on. Now, if you know something is going on, like a musculoskeletal injury, especially a mild one, you know that doing minor motions might aggravate it, but you should also cognitively know that making these mild movements is not gonna cause you danger. So what I try and train my patients to do is to break out of the cycle of pain. For example, when they have a backache, not to stand up guarding, waiting for that pain to strike. Because when you prep yourself to experience that pain, you're almost turning the volume up of that pain, your perception of that pain, making it last longer, making it more painful, and therefore potentially entering the spiral that is known as chronic pain syndromes. Copy X, tell us what drugs and alcohol you're on. We aren't gonna tell the cops, we aren't gonna lecture you, but it might change the anesthesia I give you. Some stuff I give you might kill you. Yes, very important to share all of that information. If you smoke cigarettes, especially a lot of cigarettes, that means you have a lot of nicotine exposure, you will go through nicotine withdrawal, and we can help you with that while you're hospitalized, because you're not gonna obviously smoke in the hospital. If you are consuming a lot of alcohol every single day, and then you stop out of nowhere, you can develop something known as delirium tremens, which could be a fatal condition if left untreated. Last thing we want you to have is an alcohol withdrawal related seizure. So please tell us about that. And then if you're coming in with chest pain and you're worried about a heart attack, tell your doctor if you're taking Viagra or any of these sexual enhancing medications, because that could also change our medication course. If you use cocaine, you have to let physicians know there are certain medications that we use to slow your heart that can cross-react, like beta blockers in that regard, and can cause all sorts of issues. We're not gonna judge you, but we might ask you, are you looking to stop? And perhaps just give you resources or ways to help you overcome this addiction, if that's what it is. So it's kind of a win-win scenario, to tell the truth. Ejaculating blood happens to most people at least once in their lives, and in 99% of cases, it resolves without taking any action within a week. It doesn't even warrant a doctor's visit. Peeing blood for both sexes is a serious medical emergency, and you should immediately go to the ER. People think it's the other way around. I disagree. I think if you have blood coming out of any orifice of your body and there's a concern about it, you should go see your doctor. That being said, there are different risks related to which orifice the blood is coming out and the speed of which it's coming out and how much is coming out. So I never want to tell patients, oh, you're seeing blood, no big deal, you're fine. If you get frequent nosebleeds, if you're seeing blood in your urine, in your stool, in your vomit, in your snot, have a discussion with your doctor. Because guess what? The worst thing that's gonna happen is you have a conversation and you get reassurance. Reassurance can be very good medical advice. My phone is acting up, so if this has already been posted, I apologize. But women, please do not use soap or douching products inside your vagina. It has a delicate pH balance, and this is how you get yeast infections. Wash your labia, but do not clean internally. The vagina self-cleaning just like your eyeballs. Do you wash your eyeballs? No. Do you wash your face? Yes. The line that we always say jokingly in media is that the vagina is a self-cleaning oven, so you don't need to clean it internally. And when we say internally, the vagina is internal. It's the vulva that is external, what you see on the outside, and that can be cleaned. Don't DIY surgery or hold off reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. You know what? I wouldn't even be surprised if that happened. But the username there makes me feel like it didn't necessarily happen. Definitely don't do DIY surgery. Like, I've seen people cut out ingrown toenails on themselves. It's a recipe for infection. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. Cleanses and other detoxifying products are bullshit, woo, and a waste of money. The people who sell them are predators who only care about your money becoming theirs. Very, very true. I always say, any of these over-the-counter supplement products that promise to slim your waist are actually only slimming your wallet. And yes, there are certain nutrients that the liver needs to function, but eating a healthy diet, a varied diet that is rich in fruits and vegetables and healthy proteins, will get you those nutrients. Getting more is not better than getting the right amount. If you fill up your gas tank and then shove the fuel hose in there and start shooting more, your car will not go faster. It's about having the right amount, not having more of an amount. How to check for skin cancer. If you see any moles or anything that are asymmetrical, odd borders. I mean, this is what we use in medical school to teach the ABCDE of skin cancer graphic here. But I think you should establish a relationship with either a family practice doctor who does skin exams or a dermatologist who does skin exams, especially with dermoscopy, so that they're able to see and actually diagnose which lesion ought to be biopsied, because I see too many people go undiagnosed for too long, and anytime you're waiting longer for diagnosis, the higher rates of complications, the more advanced disease, et cetera, et cetera. And think prevention here. Sunblock, shade, not going out at the peak UV levels of the day. Good advice. This is gonna sound really basic, but I wish my patients would know what meds they are on when they come to the hospital. At least once a day comes somebody who goes, yeah, I take 8 pills in the morning, 3 in the evening, 4 at lunch, but don't ask me which. Your doctor, you should know. I beg you, before going to a doctor has never seen you before, write down your meds doses all on a piece of paper. I agree this is a big frustration of ours. A lot of times I'll ask a patient what medication they're on. They say 2 blue ones and a pink. And I'm just like, come on. It's worthwhile investing in your health to know not just what you're on, but if you're also taking care of a loved one, knowing what they're on, that's gonna go a long way in helping them get better outcomes. My hope is that AI and technology can somehow improve this. Because you know what I used to do as a resident when a patient would come in and I would admit them to the hospital and they didn't know what medications they were on? I would ask what pharmacy they use, and a lot of times this was the middle of the night. I would have to wait until morning when the pharmacy opened and call and ask, in the last month, 2 months, whatever it was, what medications did the patient fill, and assume that the patient was actually taking all those medications. Not a great system. You will often feel normal even with a high blood pressure. It's often found incidentally, so don't wait until it gives you symptoms you don't want to go through. We call high blood pressure or hypertension the silent killer. Most people will have no idea that they have high blood pressure. And the important thing that I want people to know about blood pressure is it should be measured at rest, because on average, that's what your blood pressure returns to for the majority of the day. For example, if you're up and about and running around and walking and being active, that blood pressure is not accurately representing your resting blood pressure, which is what we're after in order to make the diagnosis of hypertension. In fact, you need 2 separate visits, accurately measured blood pressure at rest, to be able to make that diagnosis. In fact, here's the correct protocol in order to measure blood pressure correctly. A lot of times I see patients say, oh, doctor, I have high blood pressure. I take high blood pressure medications. And yesterday I had a headache, so I took an extra one. Don't do that. We try and control high blood pressure to reduce your multi-year risk of having a heart attack and stroke from prolonged exposure to this high blood pressure. Getting really low blood pressure from taking too much medication can hurt you right then and there, because you could stand up, and because you've lowered your blood pressure so much, there's not enough pressure to get the blood to your brain. You could fall and really, really hurt yourself, if not lose your life. So acutely, meaning in the short term in a given moment, it's better to have slightly higher blood pressure than really low blood pressure. So you gotta be careful with instituting medications. Injuries accumulate. I cannot stress this enough. Little kids have no business lifting heavy weights or getting pushed so hard in sports by some of these coaches who seem to have little knowledge of physiology or don't care about the long-term impact of the regimens. Stuff like this really changes people's lives. Before I entered the world of social media, my goal was to subspecialize after family medicine to do sports medicine. And in doing some of the initial rotations and spending time with athletes, even working on the sidelines of football games, what we saw was this pattern that was very clear to us. Kids that played single sports throughout the entire year had higher rates of injury, at least chronic injury, in comparison to students who played a multitude of sports. And those who took appropriate breaks in between sports had even better outcomes. So the idea is to allow your child to play multiple sports, to become a complete athlete, and then subspecialize later down the line, as opposed to hyper-specializing really early on. And I'm sure there's gonna be people in the comments saying, that's not how Michael Jordan, that's not how LeBron made it. Well, look, I'm not a Michael Jordan coach. I'm trying to keep you as healthy as possible, not to pick out a Navy SEAL level NBA player. So, sorry. In males, there is a vestigial remnant of the uterus located in the prostate. Oh, yep. It's called the prostatic utricle. It's not just the uterus, it's the vagina as well, and the cervix. It's a duct that leads nowhere. It sometimes has some remote endometrium in it and can produce 1 drop of blood every 28 days. I've never heard that. That's a new fact for me. So yeah, guys can get PMS too, but it's probably better to call it BMS, bro menstrual syndrome. What I'm familiar with it more so is for people who get recurrent UTIs, there can be a cyst that forms in there that needs to be treated, usually surgically, through the urethra. Not a doctor, but never flush unused medicine down the toilet or throw it in the trash, especially not antibiotics. Hand them back to your pharmacy and they will destruct them. Yeah, that's true. You remember, a lot of the water gets recycled and you don't want medications in your water supply. So please return them back to the pharmacy. They have ways of disposing properly of these medications. That chest compressions aren't like gently kneading dough as per TV Rhesus. Needs to be 2 to 2.5 inches deep, about 6 centimeters. Count them, it's significant and forceful. 100 per minute is the speed of the beat staying alive, facts. There's actually some Taylor Swift songs for you Swifties out there. Actually, Spotify has a whole playlist here. Push fast, push hard. If you aren't getting tired after a minute, you probably aren't pushing hard enough. Frequent rotation of personnel is important, but try not to skip a single beat. We count 3, 2, 1, change. Yeah, because you want as little amount of time off the chest as possible. And a little piece of advice, when you put your hands like this, try and lock out your elbows, because people think it's a tricep exercise, and it's not a tricep exercise, because that gets incredibly tiring if you're trying to do this for a 2-minute span, which is usually the amount that we do before we swap over. You wanna lean with your body weight. So always try and position yourself in a place where you're above the patient and you're able to use your body weight. Otherwise, it's very likely that you won't be able to get 2 inches deep. And know that women are less likely to get CPR from bystanders because of the fear of touching their chest. But that also leads women to not be saved when they can absolutely be resuscitated. So please, if you see someone down, step 1, call for help or nominate a specific person to call for help. And then chest compressions, chest compressions, chest compressions, just as Molly Burke was training on my little CPR kiosk, courtesy of the American Heart Association. The frequency of bowel movements can range from every 3 days to 3 times per day and be considered normal. Having 3 soft stools per day does not mean you have chronic diarrhea. It really depends person to person what is normal for you. And there are certain conditions like irritable bowel syndrome that can have different predispositions. You can have a mixed type where you get sometimes diarrhea, sometimes constipation. You could have a diarrhea predominant type. You could have a constipation predominant type. Knowing that your body has a specific norm is what's key. Because when I ask my patients about what's going on with their bowel movements, the biggest question I ask is any changes to your bowel movement. Knowing the caliber, knowing the color, knowing the consistency, the frequency, all of these are important things. And I always recommend to my patients, look after you go. Too many patients don't wanna look and flush. That's a bad idea. You're gonna be missing things. There are certain risk factors that we want patients to be on the lookout for that could be signs of something that's worth investigating. Here are those. Some things just don't belong in your rectum. I think a lot of things don't belong in your rectum. I think that's a fair statement. But then again, everyone is allowed to make their own personal choices once they're in adulthood. Yeah, boy. Having wet hair in a cold room will not make you sick. Having wet hair can really cool your scalp quickly. But as we know, it's not the cold temperatures that make you sick in the winter. If you're obviously experiencing frostbite or something extreme, yes. But going outside quickly without a jacket is not what makes your immune system susceptible to an infection. What happens in the winter, and this is partially theory-based and partially science-based, germs have longer hang time in the winter because of the dry air. We spend more time inside in closed encounters, meaning in small rooms in the winter because it's cold. And as a result, we're more likely to contaminate each other and spread all sorts of viruses. That being said, you walk into a room and someone just sneezed, make sure they're dabbing. If your baby is crying and won't stop, check their toes, and if it's a boy, check his penis. Sometimes a strand of hair can get caught around a toe or penis or a testicle and slowly strangle it, called a hair tourniquet. I saw one little baby who lost a testicle like this, and now I warn every parent to double check. This reminds me of a testicular torsion where a testicle can actually mal-rotate on itself and end up losing circulation and dying. But in a situation like this, it's an exterior issue because of this hair tourniquet. And babies cry like they're being tortured when it happens. And as soon as you take it off, well, some still are a little fussy, but they get better within a day or so. Your dick can break. Well, yes and no. It's funny because when most people call it a boner, there is no bone, but there is tissue in there that can go sideways and it can become quite painful. And there are actually surgeries that people can do in order to correct this issue. It's quite painful, not the surgery, the actual injury. It's not a bone, but it can be damaged and surgery can fix it. And not always surgery is necessary. In terms of saving human lives, hand washing is the most important medical advance of the last 200 years. In the era of multi-drug resistant bacteria, soap and warm water still work. That's true. When I was a resident, Clostridium difficile, which is known as C. diff, it's a terrible bacteria that causes the worst diarrhea ever. And what's interesting is hand sanitizer did not do a good job of getting rid of it, so you actually had to use soap and water. And multi-drug resistant bacteria is even worse because that literally means a lot of antibiotics don't work to fight off this bacteria. And if you get stuck with it, you're gonna have to reach for really rare medications that have all sorts of worse side effects. So washing your hands is incredibly important. And that's why we do it before we see every patient, before we do any procedure, etc. Actually, there was a gentleman in Hungary who recommended doctors wash their hands, but they thought he was crazy. Click here to check that out, and as always, stay happy and healthy.